Okay. Yes. Okay. Now it's so okay. So good morning all. Yes. Now it should be okay. So today would be last session, and we will try to cover all the remaining points. But I think now it should be audible. Okay. Okay, friends. So we will try to cover as many points as possible, and we will not leave any point which can be asked. So it may take little bit more time. Means I will require half hour more. I know that there is a match, and you would not like to miss that match. So we will ask means extract some time from breaks. Okay, so yes, again I would like to emphasize, yes, schizoaffective I will explain, don't worry. Okay, I could not reply few questions yesterday. The reason I was little bit busy, but today I will do. Yes, I will I will reply all your questions today. So after the class, yes, and I'm really happy that you are doing questions side by side, and it's definitely required for better understanding. But don't skip revising the notes. I have tried to include latest questions which has been asked in 4-5 years in the discussion. So I told you about bipolar affective disorder. Yes, schizoaffective disorder, some doubt is there. Yes, I will take care of that, don't worry. For the time being, yes, lithium is the best mood stabilizer. Yes, yes. We will restrict the time of break. Yes, so what I said that schizoaffective, okay. Uh, Schizoaffective, there are few doubts about schizoaffective. No need to be worried about. Schizo and affective. Symptoms of schizophrenia and symptom of affective disorder. Till now we all know that affect means mood. So all mood disorder are affective disorder, means mania is affective disorder, depression is affective disorder. So if a person is having both symptoms of depression or mania and symptoms of schizophrenia together most of time, then we say schizoaffective disorder. But in DSM-5, ICD-10 is satisfied with this criteria that if depressive symptom and schizophrenic symptoms are together, or manic symptoms and schizophrenic symptoms are together, you will make the diagnosis of schizoaffective disorder. But DSM-5 says no, no, no. We will have one more criteria. What is more criteria? That he said that other than these together, there should be a period in which only and only schizophrenic symptoms are there. Okay, and this period should be at least 2 weeks. Means suppose I am having schizophrenic symptom, hallucination, delusion for 6 months. Yes, then you will say I am schizophrenic. And I am also having depressive symptom fulfilling the criteria of depression for 5 months. Okay, last 5 months. So you will say that symptoms of depression, symptoms of schizophrenia are present most of duration, means 5 months together. But there is a period of 1 month in which only and only schizophrenic symptoms are there. So schizoaffective. Okay. So this is schizoaffective. Now Lithium, yes, I told you that I will make lithium, yes, memory map. Yes, memory map means that you can connect different things, whatever you know, and try to connect different points with other known facts. And a flow chart type, mixed flow chart means congested flow chart, you can say. Yes, if I start with lithium is just like sodium, is just like sodium. Okay, if they are in periodic table, you must have read in the they are in same column. Okay, so lithium behave just like sodium. Okay, if I ask you sodium is handled by kidney, yes, lithium is also handled by kidney. Yes, excreted by kidney. Lithium is not metabolized, sodium is not metabolized. You all know sodium is not metabolized, so lithium is also not metabolized. Sodium, no plasma protein binding, lithium, no plasma protein binding. Means they are having similar properties, lithium and sodium. When lithium is handled by kidney, and we know that lithium is having very therapeutic, narrow therapeutic index, I told you yesterday, means if the concentration of lithium is 0.8 to 1.2 milli equivalent per liter. Yes, if this is the serum concentration, then this is the therapeutic concentration. Means if the concentration is below 0.8, patient would not be treated. Means if you want treatment, you want to treat the patient, the serum concentration of lithium should lie between these two figures. Okay, between these two figures. But in any case, if the concentration of this increases more than 1.5 milli equivalent per liter, then it may cause toxicity. So it's a very low therapeutic index, means 1.2 and 1.5. So that's why the concentration of lithium should be maintained in very, means maintained very precisely. That's why before starting lithium, we always do kidney function test. As you know that kidney excrete this lithium. If kidney is not functioning properly, then lithium will not be excreted and serum concentration may increase, and that may cause toxicity. So before starting lithium, we do kidney function test, that is also called pre-lithium workup. Pre-lithium, pre-lithium workup. Yes, we all know there is sodium iodine pumps in thyroid, sodium iodine pump. So I told you lithium replaces sodium. Lithium replaces sodium. So when lithium replaces sodium, it may replace sodium at thyroid gland and it may produce hypothyroidism. Hypothyroidism. So we know that it can cause hypothyroidism. So before starting lithium, we do thyroid function test. As I told you, lithium replaces sodium, and in heart conduction, sodium is required, means lithium can replace this. So before starting lithium, we do ECG. So this is pre-lithium workup, kidney function test, thyroid function test, ECG. And one very important side effect is hypothyroidism. Second side effect, when in distal converted tubule, this sodium will be replaced by lithium. It may cause diabetes insipidus. It may cause, side effect is diabetes insipidus. Side effect is hypothyroidism. One very important side effect is fine tremors. What is fine tremor? Yes, you must be aware about fine tremors. Yes, what is fine tremor? Let me show you. Let me show you. Yes, if you put a paper on hand, if you put a paper, yes, if you ask the patient to stretch his hand and put a paper, I am not having at this time, yes, put a paper, if paper is moving, yes, you can diagnose, yes, fine tremors. What is coarse tremors? If a patient came to you, he is having like this is coarse tremors. Okay, you may remember like this. So fine tremor and coarse tremors, they are two different things, and you will remember this point, that fine tremor is a normal side effect of lithium. Means if the serum concentration is between 0.8 to 1.2, at this serum concentration there is fine tremors. But if serum concentration goes beyond 1.5, this may cause coarse tremors. This may cause coarse tremors. This is the very important point. Yes, in question, sometimes they will give fine tremors, then you will say it is a normal side effect. If a patient comes to you and patient is on lithium and he is having fine tremor, what you will do? You will give him beta blocker. But if he is having coarse tremor, means you will understand that this is a sign of toxicity. You will check reflex, hyperreflexia, increased reflexes are increased, and patient may go into coma, may cause death, lithium toxicity. So that's why, yes, questions are asked and they confuse between fine tremor and coarse tremor. So remember, if you find the word coarse tremor, you will think of lithium toxicity, and the treatment is not beta blocker. The treatment would be dialysis. You can easily remember, yes, lithium behave just like sodium, yes, and is excreted by kidney. So the if kidney is the function of kidney is replaced by dialysis. Okay, so these are frequently asked question. Okay, so side effect, now you know the side effect of lithium: fine tremors, hypothyroidism, diabetes insipidus, hair loss, rashes. Okay, and this is narrow therapeutic index, toxicity, KFT, thyroid function test, ECG. We found that lithium is having half life of 1.3 days, half life approximately. At few place 24 hours, at few place 22 hours, so approximately 1 day, 1.3 days. Okay, half life. And you must have read in pharma, plasma steady state concentration. Please do reply. Plasma state, if I start lithium today, then plasma steady state concentration is achieved after how many half lives? Please do reply. After how many half lives? Yes, please do reply. 4 to 5 half lives. Okay, yes, good. So 4 to 5 half life of lithium means 5 to 7 days. Okay, so question was asked in Apex Institutes that yes, if you start lithium today, you will check the lithium level after how many days? Yes, you will check the lithium after 5 days. After 5 days. Okay, question. So one question, if you start patient on lithium, you will check the lithium level after how many days? Yes, you will say we will check the lithium after 5 days. Now, when you will take the sample? You will take the sample, yes, 12 hours after last dose. After last dose means suppose you gave last dose in the night at 9 p.m. In the morning 9 a.m. you will ask sister why I'm telling you a story so that you will remember. Okay, the patient took last dose in at 9 p.m. In the morning, you yes, in the night you will instruct the sister, please don't give lithium, don't give the dose in the morning. I will come at 9 a.m. We'll take the lithium sample for lithium, and then you will give. Means you will take 12 hours, means you take the sample for level of lithium after 12 hours of last dose. This was the question. Okay, so these are the question on lithium. And yes, I told you, yes, lithium and the difference between, yes, where to use lithium, where to use valproate. Yes, this is very simple thing. Okay, this question we have already done. Okay, yes, I have cut down few single liners. Yes, I accept. Yeah, just like what is the prevalence. Yes, these are the old things which I think is not going to be asked. Yes, the pattern I have seen that now they are going to ask more and more clinical, but whatever I am feeling that the new advancement, new changes are there about the prevalence, I am mentioning. Okay, so uh, yes, but yes, you can solve all the clinical questions, I assure you, by these concepts. So I told you that this is memory map. You can make memory map of any topic. Wherever you find there is a long, means so much of things are there, so many concepts are there, so many questions are there. Try to connect these, just like half life, 4 to 5 half life. In this way, yes, it will help you to solve clinical question integrated way. Okay, now, yes, I told you that it is a toxicity can be precipitated. Toxicity can be precipitated if blood plasma level, so plasma level of lithium is high. And yesterday I told you that if you are giving a female patient lithium, she is maintaining well on lithium, and she got pregnant, and now came to you after 2 months, 3 months, definitely you there is no benefit because teratogenicity has already occurred. You will continue with the lithium because if you changes the lithium with other mode stabilizer, there are chances that patient may relapse with the symptoms. So better to avoid, but you will keep monitoring the lithium level because you know it's having very therapeutic low therapeutic index, and you know the hemodynamic dynamics of gynae. So this is an integration of psychiatry and gynae. Okay, that in last trimester blood volume is increased, so the dose of lithium you are giving, that would be insufficient to maintain this plasma level. So if you are giving the same dose in the last trimester, there are chances that blood plasma lithium level is decreased and patient may precipitate with the symptoms. So you will increase the dose in the last trimester, but you will keep in mind to decrease the dose immediately after delivery, because after delivery there is loads of blood loss, and in this blood loss the blood volume will decrease, and if you are giving the increased dose of lithium, then the toxicity may precipitate. So one important aspect. Second important aspect, whenever you find the question of lithium toxicity, Many times you will find a history of decreased plasma volume. Sometimes they will give history that due to some ritual reason, yes, the patient was on fasting. Due to that fasting, the patient was not having food and water for a long time and precipitated with these symptoms. Because fasting, not taking fluid, yes, the total blood volume decreased, and that this may precipitate toxicity. Diarrhea, vomiting may precipitate toxicity. So many time when you will find the question of toxicity, you will find the question in which they will give there is a precipitating factor and patient present with coarse tremors. So you will immediately think the patient is on lithium, now on fasting, now having vomiting, having diarrhea, means blood volume decreased, and now coming to cold tremor. You check the reflexes are hyperreflexia is there. Yes, immediately you will think of lithium toxicity. You will advise lithium level, and if lithium level is increased beyond a limit, then you may advise dialysis also. That may be the life saving. Okay, got the point? Yes. Now, adjustment disorder, this is very, very important. I told you that this flow diagram, I will complete this flow diagram. Yes. Now, I am telling you adjustment disorder. What is adjustment disorder? Many times we can't adjust different changes in our life, but you must have seen few person adjust very well in each and every situation. Few person can't adjust in each and every situation. So adjustment disorder is the personal thing. Means a few person adjust. You must have seen your friends also who go everywhere and enjoy the life at each and every place, each and every situation. So many times it's not a criteria. What I am saying, it's not a criteria, but it is written in ICD-10 very clearly that in adjustment disorder, usually the stressor is subjective. What I said? Subjective stressor. What does it mean? Means stressor depends on the subject. Yes, it is stressor or not. Let me give you example. There is a 29-year-old lady was divorced by her husband. So do you think that divorce is a stressor? Yes, divorce may be a stressor, but it is subjective stressor, not objective. What does it mean? Means divorce is a subjective stressor, breakup is a subjective stressor. Many times we are in a relationship, we want to get rid of that relationship, but we are unable to get rid of. But sometimes our partner, our boyfriend, our girlfriend, they do break up and we are happy. Yes, दिल पे पत्थर रख के मैंने मेकअप कर लिया like that, and we enjoy. Okay, and we dance, and then so many songs. So it depends on the subject. After breakup, few persons are very sad. After divorce, few persons are sad, unable to sleep, don't take food. Yes, sad. If I talk about another lady who was divorced by her husband, she says, now I am very happy. He was saved. I am saved. I have planned everything. Yes, I was about to kill this person. Yes, he is very irritating person. I took all the I have done all I had done all the arrangements to kill this person, but now he divorced me. He is saved. I am saved. Means it depends. I am taking the extreme thing just to make you remember. Okay, means different person perceive this divorce differently. Okay, but if I say objective stressor, war, earthquake, floods, rape, serious accident, nobody would say that it is good. Breakup, some person may say it's good. Divorce, some person may say good. Financial loss, yes, nobody would say it's good, but it would say, okay, financial loss is a part of life. I will work hard, means will not be affected so much. Other person would have heart attack. Medical illness. You must have seen few movies, just like old movie of Rajesh Khanna, Babu Moshai, चिंता नहीं करने का, है ना? You know, he was diagnosed having cancer. Even then, he was not worried at all. Means these are subjective stressor. These are subjective stressor. Means the person may take it, different person may take it, these stressor differently, but these are objective stressor. Everybody would say this is a bad thing. If war, bad. Earthquake, bad. Floods, bad. Rape, bad. So these are called objective stressor. Okay. So, why I am telling you this subjective and objective stressor? Many times in question, by looking at the stressor, you will find the answer. Many times. Notice not a diagnostic. Again, I am telling it's not a diagnostic criteria, but trust me. Yes, whenever you will find these types of stressor and you will recognize that these stressors are there. Yes, by looking at the stressor, you will think of it is PTSD or adjustment disorder. Okay. Now I would say make a note that adjustment disorder is diagnosis of exclusion. It is not written in any standard textbook. I am telling you that it is a diagnosis of exclusion. What does it mean? If you can't make a diagnosis of any other disorder, then you will make the diagnosis of adjustment disorder. What I said? If you are unable to make the diagnosis of other psychiatric disorder, then you will make the diagnosis of adjustment disorder. Suppose, yes, this girl, this lady, look at the screen, this question. This lady, divorced by her husband, she remains sad. 1 point. Unable to sleep. Second point. Food. 3 point. Can you make the diagnosis of depression? Suppose I take 14 days. Okay, means duration criteria of depression is fulfilled after the stressor, means divorce or subjective stressor. She started having these three symptoms. What is the diagnosis? I require your answer. Yes, 14 days. Diagnostic criteria of depression is not fulfilled. Stressor is there. What is the answer? Yes, A, B, or C. Yes, what is the answer? Answer is adjustment disorder. Answer is adjustment disorder. Clear? It is diagnosis of exclusion. What does it mean? What does it mean that yes, yes, good. Means if in this question I take different color. If I add 2 more point, decreased interest, decreased psychomotor activity for 14 days. Now, please do reply. What is the answer of this question? Please do reply. What is the answer of this question? Yes, the answer would become depression. Means if diagnostic criteria of depression is fulfilled, the answer would become depression. Clear? So you will remember this point. Even if stressor is there, even if stressor is there and the diagnostic criteria of depression is fulfilled, you will mark the answer as depression. Clear? So now I add in this flow diagram. Now I add in this flow diagram. If a patient came to you with these four symptoms after breakup, yes, means diagnostic criteria of depression is not fulfilled, you will make the diagnosis of adjustment disorder. Okay, but if these five symptoms, if these five symptoms after breakup, then the diagnosis would be depression. So even if the stressor is there but diagnostic criteria of depression is fulfilled, then you will make the diagnosis of depression. Clear? So I added like this. Are you comfortable with this? Yes, I think you should be. Now I add post-traumatic stress disorder. I just told you about objective stressor. Let me give you an example. You will remember the example and later on you will appreciate how simple it is. Yes, if there is bomb blast, after bomb blast, yes, means let me give you a full story. That would be easier for you to understand. Okay. There was a person who bought a new car. What I said, there is a person who bought a new car. He took whole family in the new car. Yes, he took yes, COVID-19. Okay, yes, he took whole family. Sorry, yaar. Yes, he took a whole family in a new car, and after that, yes, he went to temple. When he came out of the car, there was bomb blast. All family member died in the bomb blast. Yes, after that, yes, he started having intrusion symptoms. He started having intrusion symptoms. What are the intrusion symptoms? He started having flashback. What is flashback? Means the same scene of bomb blast in which family member died. Suppose I am sitting, I am the person, my family member died in a bomb blast in a car, and I am sitting, I am doing my work. Suddenly the same scene will come in my mind. The same scene will come in my mind. It would be very clear, vivid, very vivid. I want to stop these images again and again, but I can't control them, not under willful control. Yes, actually, bomb blast has already occurred, now it is not occurring, means perception without stimulus. So, perception without stimulus, I know that now it is not bomb blast, means flashback is fulfilling the criteria of pseudo hallucination. Flashbacks are fulfilling the criteria of pseudo hallucination. So, this question is asked, flashbacks are true hallucination or pseudo hallucination? These are pseudo hallucination. Other than this flashback, yes, when I sleep, yes, I have bad dreams, nightmares of the same bomb blast. That is nightmare. That is nightmares. Okay. After that, yes, arousal symptoms means I am remaining irritable, decrease sleep, These are arousal symptom. I started avoiding avoidance symptom. I started avoiding to go to temple. To go to temple. I avoid to sit in car because bomb blast was in car. So no, I avoid cars, I avoid temple means avoidance. If a person after significant traumatic event develop these symptoms means intrusion, arousal symptom, avoidance symptom, these symptoms are there. Other than these symptoms, the patient may remain sad, means depressive symptoms may be present in this patient, means patient may remain sad because family member died, a traumatic event occurred, patient is not having interest in daily life activity. Yes, patient may have many symptoms of depression. Okay, but even if the patient is having many symptoms of depression, if they this patient is having this criteria of intrusion symptoms, arousal symptom, avoidance symptom, you will say that this patient came to you and these symptoms are duration of these symptoms less than 30 days. Then you will make the diagnosis of acute stress disorder. But if these symptoms are more than 30 days, then you will say this is a PTSD. So it is the duration which is determining it is acute stress disorder or PTSD. Okay, again I repeat, 30 days or more than 30 days, then it is PTSD. Less than 30 days, yes, then it is acute stress disorder. In different guidelines, so they are actually yesterday I could not answer your queries. I have so many responsibility. Everybody is having. Family is also a responsibility and also the reason to be happy. It was quite late. I could not sleep on time, but I woke up at the time and took a good sleep. Okay, of only 4 hours, but I would not take sleep in the daytime because I will maintain my circadian rhythm. You also try like that. Okay, even if you want, yes, you can work if you have enthusiasm. Yes, I know that I am tired, but even then, yes, you will not find any time that I am having less energy because I want to deliver my best. Okay, in the same way in your life, yes, whenever you are tired, if you think that you can give your best, you can. Okay, it's not the physical thing, it's your uh, you know uh, mind which is determining your personality. Yes, when I will discuss gender identity disorder, at that time I will realize you that it is not the physical thing, it is the mental thing which is more important, psychological thing which is more important. Okay, so you will remember this PTSD and acute stress disorder, and the treatment for PTSD is, yes, you all know, CBT, treatment of choice, SSRI. Yes, one more technique is there. Yes, if a patient fulfill the criteria of depression, they will give, you will find that yes, many times they don't fulfill the criteria of depression. They are much more concerned about these symptoms. Okay, so even if they fulfill the criteria of depression, if they give intrusion symptoms, arousal symptom, avoidance, you will go with the PTSD. Okay, so there should be this criteria. I do agree with your concern, but most of time you will know they will not ask you to differentiate between depression and PTSD. Why? They will not ask you. Because because the symptom profile of PTSD is quite different. Means there would be intrusion symptom, flashback. In depression, you will not find flashback. Nightmares, arousal symptoms, avoidance. If this typical clinical picture is there, and objective stressor, so you will never be confused between major depressive disorder or depression and PTSD. You will look at the question, and whenever you will find the objective stressor, I am giving you the key point. You will apply this key point in all the questions at any platform. You will start doing these questions at any MLE questions everywhere. If you find objective stressor, 95% cases answer remains PTSD or acute stress disorder. Okay, they give typical symptom of avoidance, hyperarousal, intrusion symptoms. If these are present, no need to think about depression. Answer would be PTSD or acute stress disorder. Got the point? There is one more technique, EMDR, has been approved for PTSD, eye movement desensitization and reprocessing. Eye movement, eye movement desensitization and reprocessing. Yes, I am trying to simplify the things, but if you ask me, then definitely I will reply. In ICD-10, it is written that adjustment disorder may, yes, there is no fixed criteria. Again, I am saying these are not criteria, these are just a mnemonic for you. But I will tell you the exact language of ICD-10, that in adjustment disorder, the severity of stressor may vary. It may be subjective or it may be objective, but usually the stressor is subjective. Clear, RPG? So, these are the questions of PTSD and acute stress disorder. Now, stage of death and dying, grief. It's a very important point. Yes, and you will appreciate the movie Munna Bhai MBBS. If you remember Jimmy Shergill, yes, सीख ले आंखों में आंखें डाल, सीख ले देख ले, जीवन के दिन है चार, याद रख. लगे वो जिस मुन्ना भाई MBBS, EMDR, eye movement desensitization, and no, for PTSD the stressor is objective, not subjective. Okay, yes, EMDR is a technique just like psychoanalysis, Freudian theory. They said that we can treat each and every disease by EMDR, eye movement, desensitization and reprocessing. The patient is sitting in front of you. You are, yes, facing and you are moving your finger. And yes, the patient is following your finger and recalling your uh, the past event. Okay, I think they will not ask this question. Is no, this is not a drug treatment of choice. That's why they touch this when question was asked, when this technique was approved. After that, no question. Okay, but yes, this is one technique. Okay, now stage of death and dying. What is stage of death and dying? If a person comes to know that I am about to die, then he would pass through these stages. He would pass through these stages, and this is the mnemonic is dabda. Dabda. What is dabda? Let me tell you. D for denial. If you remove shock, it's okay. D for denial, A for anger, B for bargaining, D for depression, A for acceptance. Yes, these stages was given by Elizabeth Kubler-Ross. Suppose a person came to know, just like Jimmy Shergill came to know that I am having cancer, he would say, no, 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 how can it be possible? I can't have cancer. Yes, I can't have cancer. How can it be possible? He would deny. He would deny. How can it be possible? I have never smoked. I have never taken alcohol. I never went to a girl. Yes, how can it be possible? So, denial. Okay. Then, anger. Anger. Hey God, why me? Why me? I have not done this. I have not done that. Why me? Anger towards God, anger towards God, anger towards sometimes family member and doctors also. Okay, after that he would bargain to God. Hey God, this time save me. I will not do that. I will never do bad things. I will not. Yes, I will give. I will try to give prasad of 5,000 rupees, 1 lakh rupees, like that, and then you will decrease according to few movies. Yes, so bargaining. Okay, bargaining. Yes, you will bargain with the God that hey God, this time save me, next time I will not do. Yes, if a person is smoking, he would say I will never smoke, just this time save me, doctor. Hey God, bargaining. Then he would come to know, doctor would tell him, dear friend, you are having only 6 months left with you. Yes, then you will be depressed. Okay, bargaining will not work, you will be depressed. After some time you will accept, okay, this is my destiny. Yes, I have only 4 months, 5 months, 6 months. Let me enjoy these 5 6 months in the company of my family, in the company of my friends, or if I have any wish left, I should fulfill. Yes, just like Shraddha Kapoor in Ekta Villain. Yes, I am left with these things, 7 things. So means patient would go first denial, no, 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 how can it be possible? Then anger, hey God, why me? Then bargaining, okay, God save me this time, next time I will not do that. Depression, when he came to know that I can't be saved, he would be depressed. After that he would accept, okay, now I am left with these days, I will enjoy these days with my family, with my like this. Okay, so this is dabda. Okay, given by Elizabeth Kubler-Ross. So our purpose is that yes, this denial, anger, bargaining, depression, we want to avoid or cut short these phases so that a person directly accept and the remaining time can be enjoyed. If you come to know that you are going to die and you accept this, then it's good. It's good. So that's why we said that if you want to enjoy, yes, yes, if you want to accept, yes, if you want to give acceptance to the patient, you will break bad news in a particular way. In a particular way. That is spikes. S for setting, P for perception, I for invitation, K for knowledge, E for empathy, S for summary. They ask this question, what is the method of breaking the bad news? Means if you want the patient go in acceptance rapidly, you will try to break the bad news by the pattern of spikes. What is spikes? First is sitting. First is setting. Okay, sorry, not setting, setting. Setting means the patient, yes, no question on this specific point, but I will give you idea so that you will remember. Yes, we have a particular setting in which the patient would be there, you will be there, the counseling person, the disclosing person would be there. There would be no mobile phone, everything means there should be no disturbance at all. There should be no disturbance at all. So this is setting. Okay, means both person would sit in front, eye to eye contact should be maintained. There are few criterias for that, but no need to remember. That is setting. We will make a setting and we will arrange that room, isolated room, and then we will perception. Second is perception. We will ask the patient what is his or her perception about the disease, what he is thinking about the disease, what he is having, what he is suffering from. Then invitation. Then we will wait for his invitation to tell something about his or her disease. Means we will not start disclosing immediately. We will seek invitation. The patient would be curious and will give you invitation. Then knowledge. Yes, we will provide knowledge. Okay, you have this cancer, in this cancer this mutation occur, this happens, the course progress like this, and this is the thing, we have this treatment left with, and now this is your stage like this. So we will provide knowledge. Then we will put empathy and we will ask for expectation. Means we will empathize, means we will keep ourselves, means we give some emotional support, you can remember like this, and we ask what is your expectation. We have given him his knowledge or her knowledge about everything. Now we ask her expectation or his expectation, what the expectation he or she is having. And after that we summarize, okay, these are your expectation, this is the reality, and now you can go to this, means you can live your remaining life like this, and this is, you will summarize the whole thing. And many times it happens that if you do in such a way, you cut short these phases. No. Okay, cut short means these can't be avoided at all, but we will try to cut short, and there is no rule that these phases will come in a particular sequence, but yes, we remember like this. Actually, this is particularly stage of death and dying, means if a person comes to know that he is about to end, these are specific for that. Yes, otherwise you, or all bad things, doctor is not involved. Okay, in that there is a total palliative treatment, and hot spice, hospice, and hospice is there, and so many patterns are there. Okay, so this is so news of death, no. In news of death we don't follow the spikes pattern. Okay, now grief, as you told about death. Yes, breaking the bad news, death. Yes, so this is because you will not have expectation about that. Yes, knowledge. Okay, is we give bad news to family member, definitely, and this is for patient, this is for patient. Yes, you must tell the patient also what is the reality. If you don't tell the patient, definitely he would be suffering more than yes. If you don't tell, okay. If you don't tell, he would be suffering more. Yes, he must know the reality, but you will not directly go and will say yes, you are going to die. Okay. Family member, yes. For family member, yes, we don't do spike pattern, yes, but for patient we do. Okay. Yes, grief. What is grief? Grief is a normal response to death of loved one. Means if a person is dying, yeah, sorry, if a person, yes, you, let me tell you, yeah, I will take care of all your doubt, okay. Yes, just remember spike. This question was asked long time back, and they will not ask in detail about these points, but I will tell you in the last. Okay. Yes, normal response to the death of girl, sorry, death of loved one. Yes, you know that if you heard a news that your wife died. Yes, suppose a very loving couple is there, and husband got news that your wife died. He would say, he is in office. Suppose I am in office, I got news my wife died. I would be very happy. No, like that. Okay, don't think like that. These are only jokes. These are only jokes. Okay, definitely I will go into grief. Yes, I would say no, 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 no. How can it be possible? Denial. How can it be possible? I met her in the morning. Yes, she was absolutely fine. How can she die? Okay, so this is a normal response to the death of one, and I will start remaining sad. I will start remaining sad. I will remember her. I will become sad. Sadness. Yes, I would remain sad most of the time. Don't take food. Decrease food intake. Decrease appetite. Decrease sleep. I will become sad whenever I will think of her. Think of her. Yes, means many times, yes, I will become sad in waves. Yes, mourn करने के लिए लोग आते हैं. Yes, person comes, family member comes for mourning. The purpose is that when a person comes to you after the death of loved one, your mood changes a little bit. Your mood changes a little bit. Means reactivity of mood is present. Reactivity of mood present. Reactivity of mood present, and means that yes, the sadness comes in waves. You can write like this: sadness comes in waves. Means pang of grief, pangs of grief. Means whenever I will think about my wife, my loved one who died, I will start having sadness. Otherwise, yes, when somebody would come, yes, or some good news, some better stimulus would come, I will react a little bit. So this is called pang of grief. Pangs of grief or sadness comes in waves. I told you that in depression, in depression, the sadness should be persistent and pervasive. What I said, if you remember, yes, I write here. In depression, sadness should be persistent and pervasive. means all aspect of life. If somebody is coming me, means all 24 hour, in any situation I am sad, then you will think of depression. But if I am having sadness in the form of waves, pang of grief, then you will think of normal grief. Okay, I want your answer. Yes, I know that I am taking a little bit more time, but this is the most difficult part. You will not find in your guides, and confusing statements are there. Yes, that's why I am taking a little bit more time. This is the most important, okay, part. Yes, and latest updates also. What I said? Yes, in latest edition of Synopsis, they have given a complete table that in which condition. Okay, what I will do, I have included most of the things in my class discussion. Yes, what are the changes, whatever changes are there. But I will also give you the PDF, okay, of updates, so that you may read that. And if you find yes new point, then otherwise you, if I talk about that this difference, they are I think 9-10 points. Okay, but all are not important, but sometimes we as a student, we want that we should remember each and everything. At least we must have an idea. Okay, so I will give you PDF, okay, within 2-3 days. Yes, in the group, in my group, and in this, if I am able to post on this group. Yes, at few in few groups I am not admin, but in this group I am admin, so I will post. Okay, so don't worry. As I promised you that I am always there till your exam, I will remain updated and will keep you updated. Okay, so don't worry. Okay, and I have also promised before your INICT, who is really interested in INICT this time. Yes, I have made a memory map of biochemistry. I told you. Yes, it is about to complete. Then I will give you, and I will definitely describe also. Yes, that INICT either on the platform of DBMCI or my YouTube channel, or anyway. Yes, I will convey for this INICT, particularly for biochemistry. In psychiatry, I have given the flow diagrams. Yes, and trust me, it will help you. But in biochemistry, yes, I am working on that. Yes, clinical scenarios and all these things, and all the questions on the flow diagram. If you have attended my class, definitely it would be easier for you understand that flow diagram, and all the questions I have included on that. Okay, so don't worry. For INICT, I will take care of that. Okay, okay, dear. So for the time being, yes, this is latest update. They have taken the table from CTP, and latest edition of Synopsis they have given. So it becomes important, and it remains controversial for a long time, because in diagnostic criteria they have not given very clearly. So now Synopsis has clearly written that in which condition after death of loved one you will think of depression. Okay, so one thing is written that if sadness is persistent and pervasive, then you will say the diagnosis is depression. And if sadness comes in waves, pangs of grief, then grief. Okay, now if I say this person after that death of wife having sadness of mood, decrease food, decrease sleep, decrease interest, I don't mention this is pervasive, but yes, I have already told you in atypical depression there may be reactivity of mood. Okay, decrease interest, decrease psychomotor activity. Yes, no, I don't put psychomotor activity. Yes, decrease interest. Okay, these symptoms are there. According to ICD 10, the criteria of depression is fulfilled. Yes or no? Yes. Now the diagnosis is depression or normal grief. They don't mention about the sadness that yes, I am taking the clinic question scenario. They gave you there is a patient after death of his wife, he is remains sad. They don't mention the word persistent and pervasive, neither कि present है या नहीं है, we don't know. Okay, we don't know. Okay. Okay, we don't know. Yes, so this criteria of depression is fulfilled, yes, by ICD-10. Now you will make the diagnosis of okay 14 days, okay 2 months, okay 4 months. So, okay, now what is the diagnosis? Depression or grief? Please do reply. A, B. Now write, yes, I am searching, I am looking for your answer. If a person is having sadness, decrease food intake, decrease sleep, decrease interest, diagnostic criteria of depression is fulfilled according to ICD-10. Yes, what is the answer? Depression or grief? Okay, the answer is B. Normal grief reaction, even if diagnostic criteria of depression is fulfilled. The answer is B. Yes, this is the catching point. This is a controversial point I told you. And now this controversy has been resolved by Synopsis 12th edition. They have clearly written what I said. They have clearly written that these are the points which will determine that after death of loved one, patient has gone to depression. They have made a table. Now I am going to tell you those points, that what they have written. If means if diagnostic criteria of depression is fulfilled, even then you will make the diagnosis of depression, except you find any one of this, any one of the following. First, suicide attempt. Yes, if diagnostic criteria of depression is fulfilled or not fulfilled after death of loved one, suicide attempt is there, you will immediately mark answer as depression. Okay, if anniversary reaction, anniversary reaction means if you find what is anniversary reaction, yes, I will enjoy anniversary of my marriage. No, no, no. Anniversary reaction means after 1 year of death. After 1 year of death, yes, I adopted the same way of death as my spouse died. Yes, I took a car. Yes, met accident. Yes, she died in an accident. So I also did the same thing and I tried to commit suicide by accident at the anniversary of the event, not your marriage. Okay, means suicide attempt again. Duration more than 1 year. If the symptoms continues beyond 1 year, in few books ICD-11 they have given that normal grief ends up to 6 months. But yes, normal grief up to how much duration? 6 months. But for diagnosis of that is a controversial, because ICD-11 says that normal grief last up to 6 months, but for depression we will take 1 year. Fourth is mummification. Mummification. What is mummification? You all are aware about mummification. Egyptian era, you know that we used to embalm the body and keep the body. Is it allowed now? Please do reply. Is it allowed now? Mummification? You can't do mummification. Can you do mummification? It's not legally allowed to do mummification, otherwise you will be booked. This is no, but this mummification is different. Mummification means keeping the belongings of deceased deceased keeping the belongings of deceased means the room she used to enjoy, she used to live, is kept as such. This is the bed where she used to sleep. This is the chair, rocking chair at which she used to enjoy taking a sip of tea, not alcohol. Okay, and I used to make a tea and used to give her tea and she used to enjoy on this chair. You might be thinking, sir, do all these things like that in his daily life. Yes, you will also do in later part of your life. It is a lesson to both boys and girls. Boys, yes, be prepared. Girls, yes, know your rights. Okay. Yes, no, that was, yes, psychiatric illness. We in psychiatry, you know that society is a very important factor. If anything is accepted in the complete society, then you can't name that as a psychiatric disorder. Okay. Yes. So this is yes, if these things are there, you will make the diagnosis of depression. Okay. Now, so the one complication of grief is depression. One complication is depression. Another complication, many times you will find that a person after death of loved one start hearing voices. Yes, now again very very important. Yes, make a box and write. Occasional hallucination is common. Occasional hallucination is common in grief. Okay, occasional hallucination is common in grief. Okay, but content should be related to deceased person. Should be related to deceased person. Okay, means if a person says that I hear voices of my wife, yes, she is calling me from the kitchen, when I go to the kitchen and find nothing, yes, this is occasional hallucination, it is okay, yes, you will say it is normal grief. But if I am talking to my wife, the portrait of my wife continuously for 1 hour, 2 hour, then I would say you are in psychosis. Yes, if you are talking to your wife continuously, you are in psychosis. Okay, so questions, two questions I will give you. Yes, one. In the context of major loss, which of the following is a symptom that distinguishes major depression disorder from grief? Answer, please. Please answer. In context of major loss, which of the following is a symptom that distinguishes major depression from grief? Yes, answer is persistent dysphoria. I told you. Yes, answer is C. Yes, I told you that. Good. Depression persistent and pervasive. Now, an elderly housewife lost her husband, died suddenly of myocardial infarction. About a week after that, she heard his voice clearly talking to her as he would routine manner from the next room. She went to check out, saw nothing. So till now everything is okay. Till now everything is okay, means this is normal grief, means she heard voice from the next door and she could not get any voice, it's okay. Subsequently she often heard his voice conversing with her and she would also discuss her daily matters with him. Now it becomes a psychotic symptom. Daily matter, hours, yes, yes. So this patient would be treated with haloperidol. Means one complication is psychosis. Yes, one that if continuous hallucination, then psychosis. Okay, if content not related to loved one, deceased one, then psychosis. Means yes, in the same question, yes, till now it was normal grief, but if continuously, then it becomes psychosis. But if I say yes, occasional hallucination, but occasional hallucination, suppose my wife died, after that I am hearing voices, yes, my neighbors want to kill me, occasional. So the content of hallucination is not related to my wife, so you will treat me with antipsychotic. Got the point? Just like PDD. Just like PDD. Okay? So I think you have understood different aspects of this very difficult topic. Yes, please do reply. And one point left, you did not remind me. Rapid cycler. What is rapid cycler? Are char, 4 or more than 4 episode per year. Suppose a person is having 4 episodes, it may be mania, it may be depression. Yes, suppose a person is having mania, 4 episodes in a year, or a person is having mania, depression, mania in 1 year. 4 episodes in a 1 year, then you will say it is rapid cycler. Yes, rapid cycler, you will give treatment of choice is valproate. Mnemonic: if a person is riding cycle very fast, you ask the person to ride this cycle on the wall. Wall. He would not be able to run his cycle very fast. Valproate. If a person is riding cycle very fast, asked to run his cycle in this maze, he would not be able to run this cycle very fast. So he will never run his cycle very fast. Rapid cycler would be treated by valproate. Best answer. If valproate is not given the option, then carbamazepine. Then carbamazepine. Carbamazepine. Maze. Okay. So I have tried to discuss all these important points, and I took a little bit more time because this is the toughest part of psychiatry. Okay, please do reply. Did you understand this? Okay, so now we are going to start next topic, that is okay. Before going to start anxiety, again I am telling you that revise this. Most of the clinical question, controversial question, confusing questions in psychiatry are from this topic, and schizophrenia topic. So other topics, they ask very simple question. Okay, even in clinical question, yes, what I said, even in very long clinical question, just like if I ask you, yes, if you find a clinical question, don't turn your pages, just I am giving you idea. Yes, giving, yes, in a very long question, eating disorder, you saw the BMI 17.4. Yes, I will give you the key point, 7.4. No need to think, answer anorexia nervosa. What I said means no need to read the whole question. I will say okay, 7.4, answer would be only and only anorexia nervosa. Means all other topic you can solve question very easily, but this was the most difficult topic which we have already covered. So now it would be very easy for us to understand the simple tasks. Okay, anxiety. Yes, anxiety disorders. In anxiety disorder, you all know the symptoms of anxiety: dizziness. You must have experienced dryness of mouth, dryness of mouth, choking sensation, breathlessness. Yes, choking sensation, dryness of mouth, dizziness, dryness of mouth, choking sensation. One question left. Okay, that's good. Yes, Dr. Gopika, thanks. Yes, I discussed that question. Don't worry. Yes, breathlessness, tremors, butterfly in stomach, increased micturition, defecation. These are the symptoms of anxiety. You all have experienced these symptoms of anxiety. Now, before moving further about anxiety, let me tell you one question. And in fact, you will give me answer. I will change one or two word and you will give me answer. 21-year-old woman returns home from college for her summer break. She appears sad. Sadness. First is sadness. Okay. She does not show any interest. Second is interest in activity with her family which she used to enjoy. Means this is anhedonia. This is anhedonia. She reports difficulty concentrating. Third, concentration. She sleep. Fourth, appetite. Fifth, energy. Sixth, decreased. Diagnostic criteria of depression is fulfilled. Diagnostic criteria of depression is fulfilled. She denies suicidal ideation thoughts. She reports a recent stressor, yes, namely breaking up with the boyfriend 3 weeks before. They have not given the duration of symptom, that for how much duration she is having these symptoms, but we will think that if they have not given, then we will count that the number, yes, duration of symptom from the these 3 days. Good, you have given the correct answer, 3 weeks. So 3 weeks. So answer would be major depressive disorder. Even if the stressor is there and if the diagnostic criteria of depression is fulfilled, the answer is depression. In the same question, if I say that, okay, don't worry, I will discuss here only. In the same question, if I change the duration, yes, these symptoms are, yes, for 2 years. Please do reply. These symptoms are for 2 years. Means if diagnostic criteria of depression are fulfilled and these symptoms are for 2 years, yes, means they will not change much things, just they will change only one point. In place of 3 weeks, the option is 2 years. Your answer would change to chronic major, depression. Clear? Good. Now, in the same question, yes, if I, yes, in the same question, if I change the word normal, yes, if I change the word here normal, what is the answer? Please do reply. If the, yes, normal means her sleep, appetite and energy are normal, then answer would become adjustment disorder with depressed mood. Good. Adjustment disorder with depressed mood. The duration is 3 weeks. So this. So yes, but in normal and in place of 3 weeks, I say 2 years. Okay, I will definitely will modify little bit. Yes, the stressor and few things I will modify, and then the answer would become dysthymia. Good. The answer would become dysthymia. Clear? In the same question, so now you know that how question are changing, words are changing and answer are changing. Now you know very well. Okay. Yes, in the same question, yes, in the same question, if you find that yes, in past, she 2 years back, she took escitalopram. Yes, they will give us escitalopram for 9 months for sadness of mood. The answer would become yes, the answer would become recurrent depressive disorder. Recurrent depressive disorder. Good. I am getting your answer. I am really happy. Okay. Yes. In past, same question. In past, 2 year back, 2 year back, she was spending a lot, yes, over happy, spending a lot, over grooming, for which she was hospitalized, for which hospitalized. The answer would become yes, BPAD1 means 2 year back, means history of mania. They gave hospitalization word. Okay, mania. BPAD1. Good. 2 year back, yes, she was spending a lot and was over grooming, but she was managed over grooming. No need of hospitalization. Need of hospitalization. She did his household work. She did her work properly. Means answer would become hypomania and BPAD 2. Clear? So means even means few changes. Now I think you remember, now you remember, you understood the basic concept. The message I wanted to convey is delivered. I am really happy and satisfied. Okay, clear? Good. So this is called integration within the subject. Okay. Thanks for appreciation. Now we will discuss next topic. Yes, anxiety disorder. So you must have experienced, yes, breathlessness, palpitation, choking sensation, chest pain, perspiration, tremors. Yes, these are anxiety symptoms. Yes or no? Yes. Yes. Thanks for your appreciation. Yes, definitely. These your appreciation motivates me. I really work hard. Every day I remain updated. I do hard work to keep these things updated, to make the things simpler, and the trend which they are changing. Yes, they are changing the pattern, and trust me, this was the yes alarming sign for us. Yes, when they gave in this NEET pseudo hallucination. When they gave pseudo hallucination in the question, all the symptoms were given in such a way you can't differentiate between mania and hypomania. Both options were given in the question, and students were confused because there was no differentiating point other than pseudo hallucination. And to be very true, I will not tell a lie. Yes, I searched a lot, and then I read all the guidelines, and then I found that it is clearly written in the literature of ICD-10, not in diagnostic criteria, that pseudo hallucination is commonly associated, yes, with mania, not hypomania. So that's why I am, yes, trying to explore those points. Is the reason is that if we don't remember anything, it's okay, but if we commit mistake, we lose one more mark. Yes, so this is disturbing for us. So yes, a question was asked, what is the difference between anxiety and fear? Is, if you are walking through a jungle and a lion comes in front of you, you will have dizziness, dryness of mouth, choking sensation, breathlessness, tremors. So these symptoms are symptom of anxiety, these are symptoms of fear. So how you will differentiate between anxiety and fear? So the simple concept is, in fear there is a real threat. You all know that lion will not leave you, he will eat you up. खा जाएगा, शेर खाएगा तो खाएगा. In Hindi a joke is quite famous that तुम जंगल से जा रहे हो, तुम्हारे सामने शेर आ गया, तुम क्या करोगे? तो मैंने क्या करना है? जो करना है शेर ने करना है, जो करना है शेर ने करना है. Means शेर, the lion will not leave you. Okay, means that is a true threat, real threat. But if you are afraid, you are afraid of lizard, you are afraid of cockroach, yes, you are afraid of cockroach, then have you ever seen any person, yes, who was killed by cockroach? Means it's not a real threat, it is a perceived threat. Perceived threat. If real threat, then fear. If perceived threat, then it is anxiety disorder. Okay, real threat, fear, perceived threat. So this was the question, what is the difference between anxiety and fear? That in fear there is real threat, anxiety there is perceived threat. Okay, so now you will remember the example of lion and you will never forget. Now I am going to discuss generalized anxiety disorder. First disorder of anxiety, generalized, means anxiety is generalized in each and every aspect of life. Means whatever I am doing, I am talking to somebody, I am having anxiety. I am eating something, I am having anxiety. I am thinking about tomorrow's class, I am having anxiety. I am going to sleep, I am having anxiety. Means anxiety is freely floating. Freely floating. Udta tir. Okay? Yes, free floating anxiety. Free floating anxiety. So whenever you find the word free floating anxiety, yes, you will mark the answer generalized. Yes, whenever, so in anxiety disorder many times you will solve the question by phrases. By phrases. If you find the phrase free floating anxiety, no need to think, answer would be generalized anxiety disorder. And mnemonic for GAD is, yes, watchers. Watchers. Yes, Anxiety is beneficial. I told you that a little bit anxiety is quite useful. Before exam, we have little bit anxiety. During anxiety, our body prepare us to fight adverse condition. Yes, that's why epinephrine, norepinephrine are released and they prepare us. Yes, epinephrine increase blood glucose. You all know in biochemistry. Epinephrine to glycogenolysis, gluconeogenesis. We know that if some threat is there, we should be prepared for that threat and our body prepare us for that. So we usually say in exam a little bit anxiety is beneficial. That's why I told you Yerkes Dodson curve, that if you have a little bit anxiety, it is beneficial. As anxiety increases, your performance increases. But at a particular point, your anxiety is maximum. If anxiety goes beyond that, then your performance, this is anxiety. If anxiety goes beyond that, your performance decreases. So you should maintain your anxiety level at this level point. Yerkes Dodson curve. So anxiety prepare us to fight adverse condition. This is very important for us. Before exam, if you have a little bit anxiety, don't be afraid. Yes, it's a normal part of your best performance. You will perform better. But don't allow your anxiety to go beyond a particular point. And the simple mechanism is that if you do daily exercise, you start exercise in the morning, yes, for 10-15 minutes, and you will really feel. Yes, again I am giving stress to all my students. Yes, I am connected with so many students, not only for PG. Now I started getting messages from UG students also. Okay, I am a motivator. Definitely I am a motivator, but I'm not doing shows like that because I am having shortage of time. But I am planning for that also. Okay, but the thing is that yes the thing is that yes, anxiety can be controlled by your 10-15 minutes exercise and it will improve your performance. So why don't invest? What we do, we neglect this exercise and we think that in these 10 minutes this person is doing exercise, but I will read two topics. But dear friend, it's your mind is just like a computer, better than computer, but it is also having limit. If you give so many commands in a day, the complete day, yes, your computer also start producing noise. It wants some time for processing. So please give rest to your mind. Okay, I don't advise to listen music and all these things. Yes, it depends on you how you can utilize, but I will give you the productive way. Yes, other the MBBS doctor is the profession in which there would not be any time when you will think that now there is no stress. If I am talking about me, I am having so many stresses. I opened my new clinic. Now I am having stress because I am not getting time to sit there. I have invested so much of amount. So stress is a part of doctor life. So you will never think that a time will come when I will be settled and then I will enjoy. So if you want to enjoy, yes, search your entertainment, your happiness in small things and do daily exercise, remain fit, and your anxiety level would be maintained at this level. Okay? Yerkes Dodson curve. If a person is having anxiety all time, yes, thank you, Prashant. But you know, again, I'm telling you, yes, it is open for a long time, means 5-10 days. I have never visited the clinic. because of my, as I told you, the research I'm research associate, research work is pending, okay, back to back class. So but I am not, one more thing, sorry, for those who are really interested in academic content. Yes, never ever be afraid of losing something. If I usually say, if you have your both hands intact, legs intact, your body is fit, your mind is fit, you are successful. This is the definition of successful. If you are in your state of sound mind, if you are can do your work, if you can enjoy your life, you are successful. This is the definition, and make the definition for your whole life, that if you are alive, you are functional, your mind is working well, and you are enjoying the enjoyable things, then you are successful. Okay, dear? This definition will keep you happy in your complete life. I started doing this only after doing my MD psychiatry. Before that, I was always worried like this. I was always worried, excessive worry, anxiety all time. When anxiety all time, yes, you will have increased muscle tension. Suppose you are having anxiety, your epinephrine, norepinephrine will be increased. Yes, and your muscle would be tense, that any time the something may come. Yes, so increase muscle tension. When you will have so much of things in your mind, so many points in your mind, yes, decrease concentration. Hyper arousal means you start irritable. Yes, you are anxious all time, you start remaining irritable. Low energy, all your energy sources will be exhausted. Restlessness would be there. Decrease sleep. Okay, unable to initiate sleep. Yes, free floating means anxiety is floating every time, every aspect. Just like that, just like I told you, pervasive for the sadness. And yes, the word used pervasive for the sadness in all aspect of life. In anxiety, we use the word free floating anxiety, means anxiety in all aspect of life. ओके, उड़ता तीर कहते हैं हिंदी में उसे. ओके, यस. सो वाचर्स, ओके, निमोनिक. रम्या, it is Wi-Fi or wife? I am little bit confused. Wi-Fi or wife? I don't know. Yes. Okay. Worry. Yes. If these two are there, plus out of these three, 2 plus 3. Yes. Okay. Wi-Fi. Yes. Free floating, you can say. Sometimes wife is also free floating anxiety. Okay. Yes. So this is generalized anxiety disorder. Now question. A 35-year-old man comes to physician because of 7-month history. Yes, 7-month duration criteria of GAD is 6 months. Means these symptoms should be present for how much duration? 6 months. Okay. Yes. Sorry for gender specific. Okay. but I am a married person, I can do comment. Okay, you should not have any objection. My wife, I will not show these videos to my wife, so I know that they don't leak these videos. Okay, so I can speak like that, otherwise I would be have been a little bit more cautious. So but these jokes, whatever I am cracking here, don't ever try in front of your wives. Okay, in future wives. Okay, so otherwise you will be in trouble. Okay. Yes. 35. Yes, 35-year-old man comes to the physician because of a 7-month history. Means duration criteria 6 month. Yes, 7 month. So duration criteria. Let me tell you, this is a case of generalized anxiety disorder. Okay, and now I will fulfill the criteria. So duration criteria is fulfilled. Sleep disturbance, yes. Watchers, S for sleep disturbance, R for restlessness, difficulty falling asleep, lies awake worrying about his family. Worry about his family. Yes, worry, excessive worry. Next day meetings. Finance means free floating anxiety, multiple aspects he is having anxiety. 8 months ago, he started a new job as a product manager. This is very important point. Very important point, that as a product manager 8 months back, so it may be a stressor. This is important point. Stressor. He can no longer concentrate. So concentration is a point. Sleep disturbance, restlessness, excessive worry. Okay. Anxiety all time. देखते हैं. He feels tense, tension. Avoid socializing with friend. He appear anxious. So criteria of GAD is fulfilled, duration criteria and all these things are fulfilled. Yes, symptoms of generalized anxiety disorder is fulfilled, and there is a stressor. Okay, so in this question the answer is a GAD. The diagnosis, sorry, the diagnosis is GAD. Okay, in but in adjustment disorder, patient may present with symptoms of anxiety. Symptoms of anxiety. Yes, GAD. So if in this question the patient is not fulfilling the criteria of GAD, yes, I remove 2-3 points, then you may think it as adjustment disorder. You may think it as adjustment disorder. Okay, and adjustment disorder, the treatment is supportive psychotherapy, while in anxiety the treatment of choice is SSRI and CBT and SSRI. But adjustment disorder, supportive psychotherapy. Remember this point? So adjustment disorder may present with anxiety symptom, may present with depressive symptoms. Okay, so remember this point. So but in this question they have clearly mentioned all the criteria of anxiety, so you will mark the answer as GAT. Okay, I have already told you that adjustment disorder is disorder of exclusion. Yes, he appears anxious. Physical examination show no abnormality. Physician recommends psychotherapy. As I told you that the best treatment is a combination of psychotherapy and medication. The patient states that he is concerned about the side effect of psychiatric medication. He has struggled intermittently with erectile dysfunction. Normally, the side effect of SSRI is delayed ejaculation, but other than that, SSRI also decreases the desire of sex, also decreases the erection. So erectile dysfunction is also there, sometimes associated with SSRI. So definitely you will not advise SSRI to this patient. Would like medication that will not further aggravate his difficulty. Treatment, which of the following drug is most appropriate? Yes, if they have not given this last line, yes, good, they have not given this last line or intermittent erectile dysfunction in the past, then the answer would have become escitalopram, SSRI. But if this line is there, the answer is buspirone. Okay, if answer is yes, erectile dysfunction, buspirone. But if erectile dysfunction is not given, the answer would become escitalopram. Good. Clear? So this is GAD, generalized anxiety disorder, and now you have little bit idea about uh, adjustment disorder also having anxiety symptoms. So adjustment disorder may have anxiety symptom and depression symptom. So I think we should take a short break of 10 minutes. So we will restrict our discussion, break of 10 minutes. Yes, break of 10 minutes. Okay. Clear? Then in the next session we are going to discuss a very important aspect, Freudian theory also. Yes, we will touch the Freudian theory. Okay.